Hello friends, I am Dr. Sandeep Basin from Carewell Medical Center. Today I'll be talking about vaginoplasty surgery. Now, vaginoplasty is the surgery in which we tighten the loose vagina. It's especially true after 1 or 2 normal childbirths where the vagina muscles become very loose. And with that loosening there are many problems, and one of them is the females and the partner do not get as much pleasure as they used to get before this loosening. So to enhance this pleasure, physical intimacy, we have to tighten the vagina. This procedure of tightening the vaginal wall and vaginal tissue is called vaginoplasty. So in vaginoplasty we do few things. We remove the extra mucosa in the vagina. We try to reduce the excess space in the vagina. We strengthen the muscles of the pelvic floor that are forming the floor of the vagina. We also tighten the perineal muscles. The tone of the introitus is increased. Then we also make the entrance of the vagina, which is called introitus, smaller. So basically we decrease the space or the room in the vagina. We make the muscles, we strengthen the muscles in the floor of the vagina. We also make the entrance of the vagina smaller, and we tighten the perineal muscles. So with all this, the vagina becomes more smaller in size and also firmer, and its space is reduced. So that is the main thing what we want to do in vaginoplasty. Now this surgery can be done under spinal anesthesia, general anesthesia or local anesthesia, and we normally do it with circular incisions at the introitus. And the method by which we do it, we do not get any scar inside the vagina, which happens sometimes in some procedures where the scars come inside the vagina. So this is regarding the procedure. So people, especially females who are like in 30s or 40s and who have delivered 2-3 babies and the vagina has become loose, they wanted to strengthen their vagina. It's a very good surgery for these patients. Now there are other procedures also like laser vaginal tightening, but what we have to understand, laser vaginal tightening can only work at the mucosa. To some extent it can tighten the mucosa. It cannot work at the muscles, it cannot work at the entrance of the vagina or the introitus. It cannot make the entrance of the vagina tighter, neither it can make the muscles tighter. So all those things still remain in the laser vaginal tightening. So laser vaginal tightening is better thing for a young female patients who do not have that much lax vagina. So only for mild cases, laser vaginal tightening can work. Otherwise, if there is a massive weakening and loosening of the vagina, surgical method is always the better method that we should be going for. The procedure, as I said, can be done under local or spinal anesthesia. The complication that can happen with this can be problems of pain, local healing. Sometimes because rectum is in the behind, rectal fistulas, rectovaginal fistulas can form, and that can be a very difficult problem to handle with. But if otherwise the surgery is done correctly, then the patient's recovery is uneventful. They have to maintain avoid physical intimacy for about 2 months time. So after about 8 weeks, they can again come physically intimate with the partner. So these are few things that you have to keep in mind, and after the procedure we always give them some topical antibiotics, some pessaries to be used, and some local ointments to be used so that the recovery is faster and uneventful. So thank you friends, Dr. Sandeep from Carewell Medical Center.